Hello, we are team number 1. My team members are Hernández Bejarano, Villalpando Flores, Fuentes Puente, Ibarra Vela, Carreño Garcés, and me, González Castilla. We investigated and had scientific research on brain cancer. Hope you enjoy. These are our hyperlinks in the index and the general information. Okay, what is brain cancer? Brain cancer is a disease of the brain in which cancer cells arise in the brain tissue. Cancer cells grow to form a mass of cancer tissue, called tumor, that interferes with brain functions. Tumors composed of cancer cells are called malignant tumors, and those composed of mainly non-cancerous cells are called benign tumors. Cancer cells that develop from brain tissue are called primarily brain tumors, while tumors that spread from other body sites to the brain are termed metastatic or secondary brain tumors. There are two types of brain tumor types. The primary, that is any tumor that starts in the brain, and secondary, tumor growing within the brain that has arisen from the spread of a malignant tumor cancer elsewhere in the body. And examples of primary brain tumor are gliomas, meningiomas, pituitary adenomas, vestibular schwannomas, and primitive neuroectodermal tumors. And examples of secondary brain tumors can originate from lung, breast, colon, kidney, and melanoma. Grades of brain cancer. Not all brain tumors are alike, even if they arise from the same type of brain tissue. Tumors are assigned a grade depending on how the cells in the tumor appear microscopically. The grade also provides insight as to the cell's growth rate. The NCI, that is the National Cancer Institute, lists the following grades from benign to most aggressive. The grade 1 is the tissue is benign. The grade 2, the tissue is malignant. The grade 3, the malignant tissue has cells that look very different from normal cells. And the grade 4, the malignant tissue has cells that look mostly normal and tend to grow quickly. Stages of the brain cancer. The brain cancers are staged accordingly to their cell type and grade. In general, these cancer stages range from 0 to 4, with stage 4 indicating that the cancer has spread to another organ.
Prevention. The most basic indications to avoid this disease are four. First, avoid certain agents in the environment as fluoride, solvents, and oil products. Second, the most basic one and important is having a healthy diet and eat food high in omega-3. Then, the OMS recommend visit a doctor each 4 years before turns 40 to prevent any type of sickness. Finally, limit your alcohol consumption and excessive smoking. This is because can cause certain sickness. Then we have the statistics. Brain cancer ranks in the 19th place among all neoplasms and 10th among the most lethal. Each year, about 300,000 new cases are diagnosed, which correspond to 2.5% of cancer mortality. As we can see in the chart, in USA 23,890 people is diagnosed per year. In Mexico, only 3,500 cases are seen, and in Canada, 3,000 of people.
Brain cancer is the 13th leading cause of death in adults. As we can see in this graph, males have a greater probability of developing brain cancer in comparison to the opposite sex. Also, in this graph, we can see that over time, brain cancer is becoming more common as a cause of death. Now, in this poster, we can observe that brain tumors that lately cause cancer are not given the importance they should. As a matter of fact, only 1% of cancer research has been dedicated to this devastating disease. We can also notice that these diagnoses of and deaths of brain tumors are increasing.
Then we have the factors. As my classmate said, there are two types of brain tumors. So for the primary ones, the factors include the cell mutations in their DNA, in which the cells divide and multiply excessively in the body. Normally, the body controls the division and growth of cells, and these new cells are created to replace old ones or perform new functions. But those ones clump together and create an abnormal mass of cells, the tumors. In adults, the primary tumors are much less common. For the secondary brain tumors, the most common factor is that the tumor starts in another part of the body and then metastasis to the brain. In metastasis, cancer cells break away from where they originally formed, travel through the blood and lymphatic system, and form new tumors in other parts of the body. These mostly occur to the people who have a history of cancer and is much common in adults.
Now we will be talking about the risk factors that brain cancer has. First, we have exposure to radiation. This means those people who are exposed to a type of radiation called ionizing radiation are at a higher risk of developing a brain tumor. So if you, a family member, or a friend has been through a situation like this, there are chances that you can develop brain tumor. Next, we have family history of brain tumor. A small percentage of brain tumors occur in people with a family history of brain tumors or genetic syndromes. So this means that there are possibilities of you or anyone in your family to develop brain cancer because of genetics or because someone else in your family had it. Next up, we will be talking about the treatment and how to take care of it. So, what exactly is a treatment for brain cancer? A treatment plan is individualized for each brain cancer patient by doctors who are specialized in brain cancer, and treatments vary widely depending on the cancer type, brain location, tumor size, patient age, and the patient's general health status. Basically, there isn't a specific treatment because everyone is different even though they all have the same disease.
Well, some treatments. Surgery, radiation therapy, and chemotherapy are the major treatment categories for most brain cancers. Individual treatment plans often include a combination of these treatments. Surgical. Surgery is a traditional form of cancer treatment. It is the most effective in eliminating most types of cancer before it has spread to lymph nodes or distant sites. Surgery may be used alone or in combination with other treatments, such as radiation therapy and chemotherapy. The chemotherapy, it is a systematic treatment working through the whole body to prevent the spread of the disease. The drugs used will vary depending on the type and stage of cancer, as well as the patient's age and health. The goal of chemotherapy is to stop the spread of cancer to other parts of the body. Chemo side effects vary depending on the type and amount of chemotherapy drug used and how the body reacts to it. Because the chemotherapy drugs travel through the body, they can also impact healthy cells, leading to a variety of side effects. Radiation therapy. The radiation therapy is the use of high energy particles or waves to destroy or damage cancer cells. It is delivered using special equipment that sends high doses of radiation to the cancer cells or tumors. Radiation can also affect healthy cells. However, normal cells can repair themselves, while cancer cells cannot. This therapy differs from chemotherapy. It is used to treat just the tumor, so it affects only the part of the body that has cancer, and it can be administered in two ways, internally or externally. Alternate treatments. You have many choices to make about your cancer treatment. One choice you might be thinking about is complementary and alternative medicine, or CAM. CAM is a term for medical products and practices that are not part of standard care. Examples of these therapies are acupuncture, chiropractic, etc. People with cancer may use these to help cope with the side effects of cancer treatment. ease worries of cancer treatment and related stress, feel that they are doing something more to help their own care, etc. These treatments do not work for everyone, and some methods such as acupuncture might help with nausea, pain, and other side effects of cancer treatment, but other treatment options might include hypothermia, immunotherapy, or steroids to reduce inflammation and brain swelling. Before attempting to try one of these, you have to talk to a doctor to make sure that all aspects of your cancer care work together. Now we'll present a video that englobes the different symptoms, options of treatment, and research about brain cancer.
Here with us today is Dr. James Elder, an expert on brain cancer. Dr. Elder, tell us about some of the symptoms of brain cancer.
Some of the symptoms are neurologic in origin, things like seizures, difficulty finding words, difficulty talking, weakness or numbness in an arm or leg, things like fatigue, headaches, which are not necessarily specific to the brain.
What should you do if you have these symptoms?
Well, certainly if you have a seizure or if you notice the new onset of any neurologic symptoms, you should call 911. The more generalized symptoms you should definitely talk to your doctor about.
Is treatment the same for every brain cancer patient?
It's important to remember that there is no routine cancer. Every patient with brain cancer has different symptoms. The cancer is in different parts of their brain. They're different ages. They have different backgrounds, and we really try to tailor the treatment to the patient.
Learn more at cancer.osu.edu/blog.
Well, we hope you found this information useful and that you enjoyed the content. Thank you very much for your attention.